Hello students, welcome to my channel Dr. XYZ Pathology. Today I am going to discuss a very important exam-oriented difference between pathology topic dry gangrene and wet gangrene. So the first point is etiology. Dry gangrene occurs because of arterial occlusion and wet gangrene occurs because of venous occlusion. Now what is the pathogenesis? In dry gangrene there is ischemia leading to hypoxic injury that leads to coagulative necrosis, that is, there is little blood supply, fewer bacteria. Because of this, the tissue dries up and mummifies. Example of dry gangrene is atherosclerosis and thrombosis. Now, what is the pathogenesis of wet gangrene? In wet gangrene, the infarcted part is stuffed with blood, favoring profuse bacterial overgrowth. Example of wet gangrene will be severe burns and strangulated hernia. Now, what are the common sites where dry gangrene can occur? Limbs, in diabetes and arteriosclerosis. And wet gangrene occurs more commonly in the bowel, but other organs like appendix and gallbladder can also have wet gangrene. Wet gangrene can also occur in the limbs. Now, what are the gross appearance? In case of dry gangrene, the affected part becomes dry, shrunken and black due to hemoglobin breakdown. In wet gangrene, the affected part is soft, swollen, foul-smelling due to putrefaction. Now, the most important point is line of demarcation. This is present in case of dry gangrene at the junction of the healthy and gangrenous part, whereas in wet gangrene, there is no clear line of demarcation at the junction. Now, microscopically, we can see coagulative necrosis, inflammatory reaction with limited bacterial growth, and line of demarcation at the junction of viable and gangrenous part in case of dry gangrene, whereas microscopically in wet gangrene we can see liquefactive necrosis, inflammatory reaction with numerous bacteria, and no clear line of demarcation at the junction. Now the next point is spread. Dry gangrene spreads very slowly, whereas wet gangrene spreads rapidly. Now the bacterial infection is absent in dry gangrene, whereas it is always present in wet gangrene. The systemic manifestations are less pronounced in dry gangrene, whereas they are more pronounced in wet gangrene. And there can be fever, leukocytosis, septicemia, toxemia, and high risk of death. Odor in case of dry gangrene, there is no odor, it is not foul smelling, whereas wet gangrene is foul smelling due to putrefaction. Now the risk factors in dry gangrene are